Our minimum wage wasn't even a living wage for a very long time. We're just fighting for 15 now. We haven't been rewarding work. When we see income disparity in this country, the reason why it's diverged so far and so wide is because we are always rewarding CEOs. We are only rewarding shareholders. We're rewarding owners, not workers. When a company can so easily say, well, I need to get my share price up, so the quickest way to do that is fire some employees, cut a division. Oh, better yet, why don't I hire a contractor to provide the same work for less pay and no benefits? They do it every time. So how do we reward work in this country in a way that can change that? Well, lots of ways. How about some employee ownership? When employees actually own their company through co-ops or ESOPs, they can make decisions about benefits and pay and reinvesting in those companies. How about taking on this practice of CEOs get to deduct that pay? Taxpayers are actually rewarding CEOs to be earning 300 times more than their lowest worker. That has to stop. Yeah. So we need to actually call on the American economy to work for us, for our workers. We have to fight for them to have basic protections. How come employees have to sign non-disclosure and arbitration clauses? Well, you know who that protects? It protects predators in the workplace. How come we don't have basic protections like having a national paid leave plan so that you can be with your mother when she's dying, or be with your husband when he's sick, or be with a new baby at home? We're the only industrialized country in the world that doesn't have paid leave. How come we don't have equal pay for equal work? God's sakes, you couldn't be more basic. And how come we aren't helping workers like having affordable daycare, universal pre-K, these basic structural supports so workers can always work at their full potential? So that's what rewarding work in this country means to me. So let's talk about healthcare, because it's the thing that is on every New Yorker's mind. No matter where I travel in my state, the number one thing out of anyone's lips is, I can't afford healthcare. I'm worried, I just got laid off. Because I'm laid off, I don't have access to health care. Because I'm laid off, they tell me I have to go into poverty before I can actually get Medicaid. That's not right. We believe that health care is a right, not a privilege, and so we should be fighting for Medicare for all. We should be having a single-payer, not-for-profit, public option, because if we fight for that, everyone will have access to health care when they need it. So I think that's something that we have to keep fighting for. We have to make sure that we address big picture issues too. We have to make sure that we continue to fight for immigration in this country. Immigration is so important because it is not only our legacy, it's not only who we are as a country founded by immigrants, but it is the reason why we are a growing economy. All that entrepreneurship and innovation that comes from every immigrant that comes into our country is important for this country. And so we should be able to protect DACA kids. We should be able to have comprehensive immigration reform. We should stop separating parents from children at the border. And we should tell the American people that we are going to fight for immigrants in this country. It is a core value. Now, one of the easiest ways to do a lot of this stuff that I just talked about is get money out of politics. You have got to get the soft corruption out of Washington that plays every single day. Because if members of Congress only spend time with the wealthy, if they're always in this bubble of the haves but not the have-nots, if they're only listening to the very highly paid lobbyists and the people who have a lot of money who can constantly try to influence legislation, they're going to get it wrong every time. So you have to get money out of politics. We have to end Citizens United, and we have to make sure that we, the people, are being heard, not those who have the most money to spend. And then the last issue I just want to mention before I finish, I have 1 minute, 35 seconds, is we have to end institutional racism. And this is a huge problem that affects families all across New York State. And we see it in the failed drug laws. The fact that a young man who has a little bit of pot in his pocket can get arrested and have his life be ruined, opportunity after opportunity ruined because of that one conviction. If you are a New Yorker and you are black or brown, you are 10 times more likely to be arrested for marijuana in our state. We should decriminalize marijuana. We should make it available for patients. drug wars on Black and brown Americans, because that's what we have today. And it is harming the ability for people to succeed and to reach their full God-given potential in this country. So that's my time. I'm happy to take your questions.
Let's give it up for Senator Kirsten Gillibrand. One more time, we the people. All right, so we've got some great questions lined up for Senator Gillibrand. The first question is about reproductive rights, and it's from Leah Vanden Bosch, who's a member of Planned Parenthood Action Fund.
Vanden Bosch. I grew up in a conservative religious community in Northwest Iowa. I have struggled with my mental health for as long as I can remember. I've been diagnosed with an eating disorder, depression, and suicide has also been a part of my history. The recent devastating headlines really hit close to home for me. I made my own attempt when I was 12 years old. My mental health is now a priority, and I will do whatever I need to protect it. So when I found out that I was pregnant last year, there was no question with what I would do. Risking my recovery and everything that I have worked for was not an option. I put my mental health first, and I chose to have an abortion. I had my abortion when I was 7 weeks along. Last month, the governor of Iowa signed a bill that will ban abortions from the moment a fetal heartbeat is detected. This is typically around 6 weeks into pregnancy, when many women don't even know that they're pregnant. Iowa lawmakers would have forced me to carry my pregnancy to term, a woman struggling with an eating disorder, depression, and anxiety. I represent countless individuals whose life experience includes an abortion story. The reasons an individual decides to have an abortion are personal and private, but the fact that some are unable to access care should be public concern. When I needed an abortion, I had so many privileges. I had the privilege of a flexible work schedule, private insurance, financial stability, but there are so many people who do not have those privileges. People in many states already have to go through mandated waiting periods, unnecessary ultrasounds, and we have to travel long distances between the few abortion providers that we have left. Imagine how impossible these hurdles are for those who don't have the same luxuries I had. The Hyde Amendment keeps federal programs like Medicaid from covering abortion, forcing those who have the least to pay the most in order to access safe, legal medical care. And the Trump administration has just introduced a gag rule that will make it illegal for doctors and nurses to refer their low-income patients for abortion. Senator, as you work to expand healthcare coverage, what are you going to do to ensure people have access to safe, legal abortion, no matter where they live, how much money they make, or what health insurance they have?
Your question. As I said earlier, healthcare should be a right, not a privilege. And the way to get to full affordability and universal coverage is through Medicare for all. If you allow anyone, even today, if you allow anyone to buy into Medicare today at a price they can afford, you begin to shift the entire industry for the not-for-profit sector. Because what's happening is the insurance industry gets to decide which treatments you get, how many days in the hospital, and they decide it only based on their bottom line. They don't base their decisions on what's covered, on what's best for your health, your mental health, your reproductive health. They just decide it based on where they can earn the most money. And so the current system, while it was wonderful to cover all people cover kids up to 26, make sure pre-existing conditions were covered. All that was important. Until you get to Medicare for all, you're not going to get to affordability and universality. That's just a fact. So that's why I believe we should be fighting for single payer, and Medicare for all is a great way to do it. I also believe that for every woman, she should, as a civil right, get to make a decision about her reproductive health and her body. It is a basic civil right. And the problem with the Hyde Amendment is it has prevented lower income women, often many women of color, from getting that basic civil right, to have the protections they need to be able to have access to all reproductive care. And so we need to be fighting against the Hyde Amendment. We shouldn't be constantly on defense, we should be on offense. And so my hope is next year we can actually unwind the Hyde Amendment, which prevents low-income women from getting the support they need to access abortion services. We also need to end these gag rules. I mean, this administration wants to pass a gag rule that won't let a doctor talk to a patient about whether she should continue with her pregnancy or terminate her pregnancy. And for a patient like yourself, that may be a life or death issue. If she can't take the medicines she needs to stay whole and be able to deal with her conditions, you might not survive the pregnancy. So that's the whole point. And last, I want to talk a little bit about maternal mortality. The fact that African American and Latino women have a higher level of mortality in this country for giving birth to a child is beyond outrageous and immoral. And so I'm working on legislation to really change that, to create minimum standards in every hospital, because when this institutional racism, again, gets between patients and their doctors and the care they're actually given, it is disastrous results. And so we have to do better, and I'm 100% committed to that. God bless.
Thank you, Senator Gillibrand, and thank you so much for your courage and for your question. Can we please give it a round of applause for Planned Parenthood Action Fund and all that they do? It's time to stand up for women's rights as human rights. Thank you. All right. This next question about our democracy comes from Sherry Schinder from Move On.
Hi, my name is Micah Lowry. I'm the substitute sent in.
Okay.
It's okay. I'm a member of Move On. I'm from Rockville, Maryland, and I'm here because I'm very interested in voting rights. This administration so far has done all it can to make it very difficult for certain individuals to vote. Furthermore, the Supreme Court has helped them do that, and just this week, the court gave them a big hand by cutting back protections against people being thrown off the voting rolls. As a volunteer in political campaigns and community outreach, I find this extremely disturbing. It is clear that Democrats support the expansion of voting rights during their candidacy. However, it does not appear that this is a high priority for them once they are elected.
That's right.
What commitments will you make on voting rights right now, and how will you hold yourself accountable on this issue on the behalf of your constituents? Additionally, how do you plan to help those who may be ineligible to vote in states with harsh regulations, as with people who have been incarcerated? Thank you.
That question. Unfortunately, what we've seen over the last decade is unprecedented attacks on voting rights. And it's come from conservative state legislatures trying to make it very hard for people to vote, whether it's a voter ID requirement, whether it's what Ohio just did and literally just take people off the rolls every few years because they haven't necessarily voted. It's outrageous. I mean, their entire intention is to make sure Americans can't vote. We also need to unwind the laws that don't let felons vote. I mean, people, once they've paid their debt to society, they should be able to vote. It's really that simple. And so I am 100% committed to working on voter empowerment. I have a bill with John Lewis, who I got the pleasure and privilege to go to Selma with him and to hear directly from the people he represents how important this is to our core American values. We have a ton of pieces of legislation. We won't pass it in this Congress, but maybe in another one. And we have to make it much easier for people to register to vote and make that easy to not only register to vote, but to vote early. One of the other things we have to do is make sure we have a paper ballot in all these elections. We have to make sure there is a paper receipt for your vote, no matter where you vote, so that we can actually count every vote if we feel we need to. Given the last election, people really feel that we need to know that every vote that is actually voted is counted. And so we have legislation to do that too. So there's a lot of voter reform that's necessary, and unfortunately the Supreme Court's necessary. The fact that they were able to unwind some of the Voting Rights Act was really damaging. And so it's really important that we focus on the courts, that we focus on making sure every community gets to vote, that if you're in an African American district, that the lines aren't a mile long, which they do intentionally by not having enough voting booths. We have to make sure that these intentional efforts, we shine spotlights on them, speak truth to power, file lawsuits, bring it up to the Supreme Court until we get the justice we need. Because voting is our most sacred right. The other optimism I have is all these kids who are fighting gun violence in this country, they're gonna vote when they turn 18. And we have to make sure that we help them register, that they can continue to speak truth to power. When you have young women like Emma Gonzalez standing up and calling BS on every excuse every member of Congress gives her, that matters. And so we need to make sure we register, organize, and vote. And if we do that collectively, we the people, we will be able to have our voices heard at the ballot box.